Good morning. My name is Over Hidalgo. I am studying at University Catholic Santiago of Guayaquil. My presentation a tutorial English medic. My topic is a 17 years old with myopia, craniofacial and skeletal abnormalities. Definition: when was assured the patient are difficult with articulation and receive speech therapy. 12 years. I wrote a class 3 dental fusion grown pattern protrusion on the mandible. Within 12 and 20 years, the patient had the orthodontic braces and the palate expander. After the braces were removed, difficult eating and vision report yogurted.
The eye is designed to focus light onto specialized nerve endings that translate the light waves and photons into pictures our brains can understand. Here are some basic descriptions of the key parts of the anatomy of the eye. The superior rectus muscle is a muscle in the orbit. It is one of the extraocular muscles. The sclera is the white outer wall of the eye. It is a tough, fibrous tissue that extends from the cornea to the optic nerve at the back of the eye. The choroid, also referred to as the choroidea or even choroid coat, is the vascular layer of the eye. The retina is the light-sensitive layer of tissue in the back of the inner eye. It works like the film in a camera. In the middle of the retina is a tiny dimple known as the fovea or fovea centralis. It is the center of the eye's sharpest vision and the location of most color perception. Central artery refers to a blood vessel inside the eye. It gives crucial nutrition to the retina. The optic nerve, also referred to as cranial nerve 2, transmits visual data from the retina to the brain. The central retinal vein is a short vein that runs via the optic zero and drains blood from the capillaries of the retina into the large veins outside the eye. The optic disc is also known as the blind spot. This is where all of the axons of the ganglion cells exit the retina to form the optic nerve. The inferior rectus muscle is located in the orbit. It is one of 6 muscles that control the movements of the eye. The orbis area is the junction between the retina as well as the ciliary body. It is the area where the retina transitions from a non-photosensitive area to a multi-layered photosensitive region. The ciliary body is the structure in the eye that produces a transparent liquid within the eye. The ciliary body also made up of the ciliary muscle. The posterior chamber is a narrow space behind the peripheral part of the iris, and in front of the suspensory ligament of the lens and the ciliary processes. Anterior chamber is the front section of the eye's interior, where aqueous humor flows in and out, giving nourishment to the eye and surrounding tissues. The cornea is the transparent front part of the eye that covers the iris, pupil, and anterior chamber. The iris is a thin, circular structure in the eye, responsible for controlling the diameter and size of the pupil. The zonule of zone is split into 2 layers, a thin layer, which lines the hyaloid fossa, and a thicker layer, which is a collection of zonular fibers. The eye is designed to focus.
Pros and cons. Pros. Use a contact lenses. We always recommend lenses on every day. Despite squeeze that are nude and the light hider. He deserves the joys and turn the hygiene prevention and infection the eyes dry eye syndrome. At cons, visual problems sharing may appear the early age, affecting the ear current learning and livid mind. Therefore, we award their examination with children that check a current health on the ear eyes. The result of the operation might be as respect it made to the after the myopia operation. To retrieve the defect is not complex current and it may be necessary to continue to wear glasses.
What is myopia? Myopia is an eye defect due to which the eye is not able to see distant objects clearly. This occurs when the light rays entering the eye converge in front of the retina in the vitreous body. Here you can see the formation of the image in a normal eye and in a myopic eye. In the case of a normal eye, the rays of light from the flower falls on the eye and converge on the retina, whereas in the case of a myopic eye, the light rays are focused in front of the retina. Myopia is caused due to elongation of the eyeball, decrease in the focal length of the eye lens. A concave lens is used to rectify this optic abnormality. The ray diagram shows how a concave lens helps in focusing the light on the retina.
Uses applied in Ecuador. We currently have the excimer laser to Netinio TM5007. This payment to later more predictable, occur and relate result to patent. This modern excimer allows better result and less time. This laser is some special feature like air tracker and air tracker, which are long for the cyber surgery.
doctor has recommended that you undergo laser in situ keratomylosis or LASIK laser surgery to correct the vision problem. But what does that actually mean? The human eye is constructed like a camera, with a clear lens in the front and light-sensitive tissue at the rear. This tissue makes up the retina, which acts like photographic film. In an eye that has perfect vision, light rays passing through the pupil are focused by the lens to fall precisely at the center of the retina. There are many common problems that can affect the eye and prevent light rays from focusing properly on the retina. 3 of these problems: myopia or nearsighted,
osteomyelitis is infection of the bone. The infection can originate in another part of the body, in the throat or skin, for example, and spread to the bones via the bloodstream, or it can develop after a bone fracture has broken the skin, infecting the bone directly. It may also spread from an adjacent area of infection, or settle in an area with inadequate circulation. The infected bone becomes inflamed, resulting in severe bone pain, fever, and the formation of pus. Single episodes of the disorder, known as acute osteomyelitis, are most common in the arm and leg bones of rapidly growing children. Chronic osteomyelitis, a rare and stubborn form of the condition, causes persistent bone pain for years. This form of the disease may also lead to complications, including skin abscess, bone deformity, cessation of bone growth in children, and amyloidosis, the deposition of a waxy substance into tissues and vital organs. Chronic osteomyelitis is more prevalent among adults and most often affects the vertebrae or pelvis.
Thank you for attention.